Our next step in looking at various pathogens is going to take us into the viral world. And as we've already touched on previously, viruses are unique in that they aren't technically living things, right? They have genetic material, they have proteins, and that's really about it. And so their sort of inability to reproduce on their own makes them not considered living things. So, sort of an extension of that is that we also don't classify viruses like we classify true organisms. So these don't have a scientific name, right? They don't have a genus and species like bacteria do. These aren't, Staphylococcus aureus. These are just the blank virus, right? The influenza virus, the coronavirus, or whatever it might be. But we do still break viruses up into families. And again, this is different than the family we use in like Linnaean classification. This just kind of means group. And the viruses are typically grouped by what type of genetic material they contain. So we're going to start with DNA viruses, viruses that are a protein capsule with double-stranded DNA inside, similar to us, right, or bacteria. Now, the most well-known group or family of double-stranded DNA viruses are the herpes viridae, the herpes viruses. Now, one thing I want to make sure isn't too confusing here, the herpes group actually includes a number of viruses. It's not just herpes, as you may think of when you hear that. And so that is what we're going to start with, is true herpes infections. But the herpes viridae group actually includes some other things you've probably heard of before too. So if we start with herpes viruses, now herpes, technically speaking, is the herpes simplex virus, right, HSV. And there are two types of herpes simplex viruses. There's HSV1 and there's HSV2. Now, both of these infections cause blistering, right, as a symptom. Now, HSV1 is typically discussed as occurring above the waist. So people who suffer from herpes blisters around the mouth, like this individual here, although this is a particularly severe case in this picture, but these little groups of blisters around the mouth, this would be most likely an HSV1 scenario. Now, herpes simplex virus 2, or HSV2, typically causes genital herpes, or we would say causes herpes and blistering below the waist. And so this can cause blistering of the genitals. Now, the herpes viruses are really interesting because most of the time, right, so most of the time, you are asymptomatic, meaning you don't show any symptoms, right? So people with herpes have little outbreaks of blisters, maybe once a year, maybe more than that, maybe less than that. And these outbreaks of blisters actually tend to coincide with maybe high levels of stress or things like that, which we don't quite exactly know how to explain. But this makes it interesting. But what you want to remember is that people who are positive for the herpes simplex virus are always contagious. All right? So even if they are asymptomatic, even if they don't have any active blisters on their face or whatever, that virus is in their saliva or other body fluids and can be transferred from person to person. So here's some kind of staggering statistics. And I know this is 10 years ago now, but these are still pretty much the same thing. What scientists say is that in the U.S., we have about 67 million cases of symptomatic herpes, where we know that someone is herpes simplex virus positive because they have experienced these blisters before. That's 1 in 4. So that's 1/4. If you think about that, that means, maybe, it depends on age groups and stuff. Maybe 3 people in our class, right, would be herpes positive. And this doesn't mean they've done anything bad. This might mean that it came from their parents, who have HSV1, and it's in their saliva, and it's now transferred over to the kids. But 1 in 4. But then check out this other thing. The CDC suggests that probably over 66% or over 2/3 of Americans actually do carry one type of herpes or the other. So again, 2/3 of Americans are probably HSV positive. Many of those will just never have symptoms in their life, which is weird to think about. But it probably means the virus is there. So really a crazy common pathogen that we see. Now, the other, or some other double-stranded DNA viruses in that herpes viridae family, again, are things you've probably heard of before, but you just didn't realize it was a herpes-type virus. So the first one here is Varicella Zoster. Varicella comes from a Latin word for chicken. Right, and so this is what causes chickenpox and also causes a second disease called shingles. Now, I'm assuming that you guys know a little bit about this, but what's interesting is that you all probably don't know quite as much as maybe I did as a kid, because you all haven't had to deal with this. Nowadays there is a vaccine or an immunization that we give to kids for the VZV, the Varicella Zoster virus, that keeps them from getting this. When I was a kid, and really not even that long ago, that far back, you just kind of had to get it, right? Now, what's interesting is there's really only one strain of this. So once you've had chickenpox, you don't get it again. That's why I put been there, done that here. Once you've had chickenpox, your body develops that immunity to it, and you won't get it again. So when I was growing up, once you had chickenpox, you just didn't have to worry about it anymore. But nowadays, again, you have the vaccine out there, so you don't even have to worry about getting it the first time. But chickenpox, causes a pretty nasty thing. It typically causes fever and a lot of weakness in kids. But then it causes this really blistering. We got these blisters that are incredibly itchy. And so a lot of people my age, a little bit younger, a little bit older, have chickenpox scars because they scratched at the blisters. So that's really common in adults, middle-aged adults, is chickenpox scars. But you get these blisters all over the body that are just really, really itchy, like you see in this young lady here. So this would be, chickenpox would look like this picture. Now, the weird thing about Varicella Zoster is that, like a lot of viruses, you never get rid of it. So kind of like the herpes simplex on the last slide. Even if you don't have the blisters, the virus isn't gone. It's sort of like it just kind of is hiding inside of you, which is creepy to think about too. But we think this is true of Varicella Zoster, and what can happen is that this virus kind of hides in your nerves, your neurons. And for some people, it will wake back up, quote unquote, so to speak, and cause a different disorder, a different set of symptoms. And that is what we call shingles. Now, we call it shingles because it causes a rash that is like a shingle on your roof. So if you look at this second picture, right, this would be an example of shingles. This is typically going to happen to older people, right? Not always, but typically older people. And what you notice here in this person is we've got this rash that's just right here. It's not spread over the whole body. It's in this one place. Causes, again, a lot of like blistering. This tends to be more painful than it is itchy. My grandmother had a lot of issues with shingles several years back. And it can be very painful, and these can kind of break out on you. They can kind of go away. It'll come back again. But what's really, I think, really interesting and really fascinating is that shingles only causes a rash in the area of that nerve that is infected. So that's why this causes such a nice delineated place right here on this picture, is because it's only affecting that one area that nerve goes to, called a dermatome. And so what you can see is that you will never cross the midline. All right, so shingles never crosses the midline of the body. That's one of the ways you can diagnose it. Because if you think about it, this is going to be a terrible picture, but when we look at the body, right? You've got your brain up here and then your spinal cord, and the nerves all come out from the spinal cord. And they either go to your right or your left side. They don't cross the midline. So if only one nerve leads to the rash, then it won't cross that midline of the body. So it's really kind of interesting. Now, the next herpes virus is called Epstein-Barr virus. Epstein-Barr virus is one of the causes. In fact, it's the more common cause of mononucleosis, or mono, right? And mono is oftentimes referred to as the kissing disease. It's called that because it is found in such high numbers in saliva. So certainly kissing people, but also eating after each other, drinking after each other, things like that is an easy way to spread mono. Like I mentioned, mono can be caused by a couple other things. There's a virus called cytomegalovirus that also will cause it. But Epstein-Barr or EBV is the most common thing that we see causing mono. This is most common in your age group, so most common in teens. It is unfortunately very drawn out, so you can get symptoms from mono for a very long time. It can cause kind of flu or cold-like symptoms, but also then tiredness is the big one. So if somebody kind of has an ongoing issue where they just feel really tired, they maybe pop a weird fever here and there, and it just seems to hold on and not go away, that might be a time to test for an Epstein-Barr infection or mono. Now, another double-stranded DNA virus that is unique and interesting to talk about is HPV, the human papillomavirus. Now, if we went back 20 years ago, when I was in high school, you would have heard very little about HPV. It was not something that people really talked about, primarily because it was not thought to be that common, and it was not thought to be something that was that severe. And then they found out that they were wrong. And so today, particularly for you guys as young females, there's a lot out there about HPV. Now, if we start from the beginning, HPV, a papilloma, right? A papilloma, you probably didn't know this, but maybe you did. This just means a wart, right? So human papillomavirus actually causes about 70% of all common warts that people experience on their skin. So if you've ever had a wart like on your knuckles, it's really common on the back of your hand, or a plantar's wart on the sole of your foot, that was probably caused by an HPV infection of the skin. We'd call that like a localized skin infection. So it's just in that one little place. Now, what's crazy is that sometime in the past maybe 30 or 40 years, HPV has become the most common sexually transmitted disease in the United States. Because not only can this cause warts of the skin, this virus can cause warts of the genital area. Right? And so if you look at the statistics for this is a couple years ago that I looked this up, but roughly 27% of women in your age group, and I know this is a big range, 14 to 59, but basically what we're looking at there is the age group of reproductively active females, right? 27%, so a little over a fourth of all females are probably HPV positive. Now here's the interesting thing too. As a sexually transmitted disease, HPV usually does not show any signs or symptoms, right? Your immune system can handle it, so to speak, right? And so most people, do not get warts from this. Sometimes we do see them, particularly in someone who has a compromised immune system for one reason or another, but usually you're not going to ever see symptoms. The only way that you find out someone's HPV positive is typically, by a test for that, which we'll talk about here in just a moment. Now, that said, it can cause papillomas or warts on the genitals, and the genital warts are also more common in females than they are in males. Now, we still haven't gotten to why did this become such a serious concern just yet. Now, before we move on, so here's some pictures of warts, right? These would be examples of, warts like I mentioned on the knuckles here. Kind of hard to get rid of if anybody's ever had one before. There's a lot of different things on the market that you can get at the store to help you get rid of warts. You can also go to a dermatologist and they'll usually try to freeze it off. This is a plantar wart. Plantar wart can be even harder to get rid of on the base of your foot. And then I have this picture of cauliflower, which is just kind of funny. I did not want to put a picture of genital warts in this thing, but a lot of times people say they kind of look like cauliflower. So you can use your imagination with that. Now, the reason that HPV has become such a big concern is that scientists tied HPV to cervical cancer. In fact, cervical and vaginal cancer. What they showed is that the HPV virus can cause genetic changes in cells that lead to cancer. Right now this is an interesting thing, because if we could figure out a way to prevent the viral infection, we could probably eliminate a lot of cases of cervical or vaginal cancer, which again obviously is a much bigger concern, because now we're talking about something that can actually even just be lethal in terms of cancer. And what's kind of interesting is it was most of the research work was done right around us. It was done at the University of Louisville and at the IU School of Medicine up in Indianapolis. But two vaccines were developed and approved, one called Cervarix and one called Gardasil. Gardasil is the much more common one today. I'm assuming a lot of you have had this. It's a series of shots that I've heard are actually quite painful, but I'm a little older than the age group we worry about giving this vaccine to, so I never had it. But this is a somewhat controversial vaccine. We'll say why here in just a moment. That is recommended to prevent HPV infection. And the statistics show that it's highly effective. I think it's something like a roughly 70 to 75% drop in HPV positivity in the American public that we've seen since we roll out this vaccine and use it on people, which is great, because that big of a drop in HPV positivity means a big drop in cervical cancer. And again, sort of the best way to treat cancer is to never have to treat it and to prevent it in the first place. And this can prevent these cancers. Now, the reason this is controversial, and I think it's becoming less controversial now, but when it first started, it is recommended for young people before they are ever sexually active. In fact, if someone has become sexually active, it may be almost kind of pointless to give it to them. Because again, it's such a common sexually transmitted disease. But if we can give it to young people before they're sexually active, then we have a really good chance at preventing an HPV infection for that person ever. Now, the reason this becomes controversial is because doctors are asked to suggest this to parents as early as age 12 in their kids. And so again, now as the public has learned more about this, it's probably a little less controversial. When it first came out, the doctor comes into the room and says, "Hi, Mom and Dad, I think that your daughter should have this vaccine." And they say, "Okay, what's that for?" And they say it's for sexually transmitted diseases. And your little Susie, their daughter, is 12 years old. The parents are going to be offended by that. All right, the suggestion that their daughter is sexually active or will be soon. But again, we know it doesn't hurt someone as young as 12. And so it's best to give it to them when we assume they have not been sexually active already. Now, I put on here too, obviously the vaccine is recommended, but it's also just really good to have pap smears performed annually. So you guys are still a little bit young, but as you get a little bit older, and particularly as you start to think about maybe having kids and things, you want to probably develop a relationship with a gynecologist, a doctor who really specializes in women, and think about having an annual exam where you might want to get mammograms to screen for breast cancer, like we learned first semester, and you also get a pap smear, which is the removal of some cells from the vaginal wall. So I know that sounds really pleasant, but pap smears allow them to test for HPV infection, but also to test for changes that could indicate things like cervical or vaginal cancer. And pap smear is short. Pap is short for Papa Nicolau, which is really fun to say because it was first developed by some Hawaiian doctors. All right, so then the last thing we're going to talk about today, which is going to be bigger than it would have been in the previous years, is the viruses that cause a cold. All right, so we're going to shift gears a little bit over to RNA viruses. So these are viruses that carry RNA, genetic material. They don't walk around with DNA like our cells do, but they have RNA inside. And so what we start with are the most common of the RNA viruses, which are the ones that cause the common cold. Now, in years past, I would have just blazed right through this and moved on, but for obvious reasons, we're going to talk about this a little bit more this year than we have previously. So common cold is usually caused by a rhinovirus. Sometimes it can be caused by another group of viruses called coronaviruses, which you probably never would have heard of before until recent current events. Now, coronaviruses are what are called positive RNA viruses. We're not going to go into kind of what that positive negative means. But then rhinoviruses, there is just a huge number of 113 different types of rhinovirus, and these can be positive or negative type RNA. The main point being, there are a lot of different viruses that can cause a cold, and this is why you get so many of them, right? Now, a cold we've all had, right? Leads to symptoms kind of like allergies as well. Sneezing, runny nose, which is medically referred to as rhinorrhea, nasal congestion, right? A stuffed up nose. There's that word pharyngitis again, sore throat, dry cough. These, when you have a cold, they rarely cause a fever. And we'll talk a little bit later, a couple of weeks from now, about this too, some more. But, a cold has to be transferred basically from person to person, and it typically requires close contact. So we believe the cold has evolved to not be real severe, like these rhinoviruses, right? None of them are very severe because it wants you to keep interacting with people. So usually a rhinovirus infection that causes the common cold, you just feel a little lousy, but you still go to school, you still go to work, and that way you can spread that cold to other people. Now, a couple things real quick about the cold. First, this little Batman cartoon is used for a lot of different things, but first thing that you probably know already, you've run into this before, is that, and I should have said it before now probably too, but, viruses don't have a treatment, right? There's no real way to treat viruses usually. We'll talk about that a little more next week too, but there's usually not really a way to treat viruses. The only thing you can do is prevent them and then, kind of weather the storm once you have one. So, when we talk about antibiotics are only for bacterial infections. And the medical world has, worked very hard over the past, say, 15 years or so to get that information out to the public, right? That antibiotics are only used for bacterial infections. Viral infections are more common, things like a cold, and so there's usually not a treatment for it. You just have to kind of take it easy, rest, lots of fluids, and get better. Now, the other thing that I wanted to bring up about the cold is I've been asked before, well, why isn't there like a cold vaccine or something? Well, there are just so many different types of virus that can cause a cold that you could give a vaccine, but someone would just get a different type of cold, right? And again, scientists have said before, there are probably so many different cold viruses that you could get every single one of them in your life. And you could have a cold or let me back up. You could get a cold twice a year for your whole life and still not get every strain of cold virus that's out there. So, this is why you do tend to get a cold, every year or two, a couple times a year, whatever. But if you've had a certain type of cold before, that particular strain, you won't get it again. And I'll give you a great example. Last year, there was a cold that was actually a pretty nasty one that kind of went through our family. And I think Charlotte had it first, and got it at school. And it was bad enough that I think she took at least one day off of school, that it was bugging her and making her so snotty. And then, of course, my wife got it after that. And so I was just, counting down the days. And then Eric got it. And again, pretty bad for a cold. And then I remember distinctly Eric even like sneezed in my face. Like I felt Eric sneeze go in my eyeballs. And yet I never got a cold. So, of course, I just bragged to my family and my wife that it's because I have a superior immune system, because I'm awesome. But the reality is, for some reason, I had probably had that particular cold virus before in my life. It might have been a little kid. It might have been when I was in med school. It might have been I caught it from a Mercy kid. But I'd probably had that one before. So even though everybody else picked it up, that one, when my body saw it, it easily eliminated it. Now, let's move on to the elephant in the room here, which is that there's a much bigger coronavirus deal going on than we've ever had before, at least in the United States. And so we want to take a minute here. I just have a couple slides where there's so much we could talk about, but I just want to talk about kind of what is this virus that's caused this coronavirus pandemic, and kind of what does it look like, and why is it doing what it's doing. The first thing I wanted to point out, I found this interesting quote from E.O. Wilson, which is that old dude that's a very famous biologist. He wrote the little free textbooks we use. And he says, the variety of genes and viruses exceeds that in all the rest of life combined. So what he's saying there is that viruses on our planet carry around so many different unique genes, so many different mutated variations of genes, that the genes they have outnumber everything else on the planet. What that really means is that viruses evolve very easily, right? They change very easily and very rapidly. So, some vocab first, right? You've probably heard all these different things. COVID-19 is the name of the disease that is causing a pandemic right now. And so in the future, we'll be able to talk about this 2019, 2020 pandemic. So COVID-19 is the disease that you would diagnose in your patient. The pathogen is what we call a novel coronavirus, and it's technically called SARS-CoV-2. So this is technically the pathogen, or the specific type of coronavirus that we're dealing with is called SARS-CoV-2. Now, when you look at viruses, most of them are species specific, meaning that they only affect or cause disease in one type of organism, right? And there are viruses that infect humans, and there are viruses that infect cows, and there are viruses that infect plants. And typically, they don't cross streams there, right? Like you could have a virus go outside and sneeze on, a tomato plant, and your tomato plant is probably not going to get your virus because its cells are so different than yours. But every once in a while, a pathogen will mutate or evolve in such a way that it will develop the ability to infect another species. Now, this is not super common, right? And this is a rarity for these types of mutations to happen and actually become successful, right? But these viruses and these other animals and in us are constantly evolving, and every once in a while, a weird version pops out that can infect something else. And this is also why typically, illnesses don't pass from you to your dog or from your cat to you, is because, usually those infections are species specific. Now, COVID-19 is caused by this SARS-CoV-2, which came from bats, and you've probably heard that already. Right, so this was a coronavirus that infected bats, and then we started to notice that it was infecting humans in this what's called the Wuhan province of China. And this is a big industrial center. So a lot of people come in and out of Wuhan, China, which is then why it was able to spread. But what you want to think about, too, is the mutations that allowed this virus to jump from the bat species to the human species also probably make that virus different than its typical cousins, right? So this new coronavirus might have a different symptomology, right? It might be more or less contagious than a typical coronavirus. it might be more or less dangerous than a typical coronavirus would be. And again, a typical coronavirus is just like the common cold, but this one's a little different, right? And then this idea of a novel virus means that it's totally new to all humans. Since this new thing just jumped out of bats over to us, no one has had it before. Isn't that weird to think about? So when that first person got infected in China, no one on the planet had ever had that disease, that specific disease. And so none of us have an immunity to this, right? None of us have had a primary response to it to develop an immunity to this thing. And when you find a new infectious disease that no one has immunity to, it can spread like wildfire. Now, a little bit more then about kind of structure. Here's a picture. This was released a few weeks ago of an electron image of SARS-CoV-2 and what this virus actually looks like under an electron microscope. We call these coronaviruses because they tend to have this corona or halo around them. Right? You can think of like a corona like around the sun, right? And this corona that you can see in this picture, right, these little things sticking out, is caused by these proteins called spikes that stick out of the surface of the virus and allow it to stick to host cells. So in other words, these things can latch on to enzymes. We have these enzymes called ACE2 enzymes in humans, and these spikes on the SARS virus can stick to that enzyme and then gain access to our cells. Now, scientists just a week or two ago discovered that the SARS-CoV-2 spikes are about 10 to 20 times stickier, or 10 to 20 times more likely to bind to human cells than some similar viruses we had seen in the past. You guys may be aware in 2002, 2003, there was a SARS outbreak. It was mostly limited to Asia and Europe. But that was the SARS-CoV virus, or SARS-CoV-1, right? But this SARS-CoV-2, this new thing causing COVID-19, is 10 to 20 times stickier, more likely to stick to your cells, which probably has enabled this new coronavirus to be way more contagious, right? To much more easily and quickly spread from person to person. And if you're curious what the SARS stands for, SARS stands for Sudden Acute Respiratory Syndrome. Now, last little thing, here's a couple medical workers at a drive-through testing site, which they're putting up in different places across the nation. These, brave ladies here are decked out in gowns and gloves. They've got the shield here on their face, and then masks. And you're probably seeing in the news and stuff that this is called PPE, personal protective equipment, right? And there's sort of a shortage of this because it is so needed in hospitals and doctors' offices and things across the country. But, if they're going to interact with somebody who is potentially breathing out or sneezing or coughing out this SARS-CoV-2, they want to be fully protected. Now, another thing that's really interesting, and I think we talked about this before we went on our hiatus from school, is that if you have a fully functioning immune system, COVID-19 typically causes something kind of like the cold, just a little more severe, right? In fact, it's sort of like something between the cold and the flu. And this is right now about 80% of cases that doctors are seeing. It does tend to cause a fever, so that's a little atypical, right? That's not your normal cold. But otherwise, it causes a cough, a sore throat, causes some aches and pains, so that's a little bit more like the flu as well. General tiredness, maybe a little bit of shortness of breath, particularly if you are trying to do something like exercise. But, it appears to be the case for this, and within a few days, it appears to go away for most people. However, if you have a compromised immune system, the pathogen can quickly lead to severe breathing difficulties, something that we call ARDS, or acute respiratory distress syndrome. In this scenario, this can basically begin to cause lung failure, and the person feels like they are asphyxiating, right, choking, or drowning. And if this occurs, it can lead to death. So this can be very serious and very severe in people who are immunocompromised. Now, I do want to take one moment before we wrap up to point out that this is not maybe as clear as it seems. People with weakened immune systems would include babies, right, the very young, and the elderly, the very old. But it also can, involve people who have underlying diseases, right? People who have diseases of the immune system. People who have autoimmune diseases, which is where the immune system kind of attacks the self. But also people who just have a history of infection. And that sounds weird. I mean, we all have a history of infection. But I can give you an example, right? Like, if there was a young person who kind of thinks that they are, shouldn't be scared of the coronavirus outbreak. They're young, they seem to be healthy, whatever. But let's say that she actually had a strange case of pneumonia, a bad lung infection, when she was a sixth grader. It was very random, actually caused her to go to the hospital for a day or something. And then she got over it, she was fine. Well, pneumonia in a sixth grader is weird. That shouldn't really happen, right? And so that is maybe a clue that that person has a somewhat compromised immune system, at least when it comes to their lungs. And so again, even though they might be fully healthy right now and seem to be fine and they're in that young age group, if they have a patient history there, it might be kind of a hidden sign that they are a little at risk to this. And this is why we have to take it seriously. Right? This is why we have to do what we're doing right now as extreme measures and social distancing and things. But it's because obviously there are those people who we have to look out for, the very young, the very old. But there's also a lot of other people out there that might not even realize that they have a somewhat compromised immune system. And we have to look out for them too. And so we hope that this doesn't affect any of us in our Mercy community, but it could. And so we want to keep hanging in there and keep doing what we can. All right, so that wraps up the first part of viruses. The second part of viruses we're going to touch on next week shouldn't be quite as long. So thanks for listening, and I hope to see you guys soon.